Now we are moving to epigastric pain syndromes. Epigastric pain syndromes. So let's go. We're going to try some questions again. Okay. So because that's what we do, is that we review questions and then we move on to delve deep into the concepts. So let's try some questions. You have a 45-year-old male who presents to the emergency room with severe constant epigastric pain. This pain radiates to the back. He reports nausea and vomiting. And the pain started suddenly after a heavy meal. On examination, he has epigastric tenderness and his serum lipase is significantly elevated. What's the most likely diagnosis? A, peptic ulcer disease. B, acute pancreatitis. C, gastroesophageal reflux disease. And D, acute myocardial infarction. What's your answer? Dr. Khadija says B. Dr. Jagdeep says B. So it looks like everybody is going for acute pancreatitis. Why? Why is acute pancreatitis the correct answer? Because acute pancreatitis typically presents with sudden onset of severe epigastric pain, and this pain radiates to the back. It shoots to the back. So look for sudden onset of acute abdominal pain, which goes to the back. And it presents with nausea, it presents with vomiting, it presents with elevated serum lipase. Remember that elevated serum lipase is more specific for acute pancreatitis than elevated serum amylase. Why? Because amylase can be produced in the salivary glands. So if the patient has, salivary gland infection or inflammation like sialoadenitis, that can also be elevated. But lipase is more specific to the liver. So that is why B is concerned. It's correct. Now remember that peptic ulcer disease typically does not radiate to the back. Okay, GERD usually presents with heartburn and regurgitation. It does not radiate to the back. Myocardial infarction would involve symptoms like maybe some shortness of breath, maybe some exertional symptoms. It depends on how it presents, right? So that is not correct.